Hello and welcome to our show today. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. Lung cancer continues to lead in cancer incidence and mortality for both men and women combined. The American Cancer Society estimates that in 2013 there will be 228,190 new cases of lung cancer diagnosed in the U.S. and 4,560 of those will be in Kentucky. They estimate that 159,480 deaths will occur from lung cancer and 3,510 of those will be in Kentucky. Lung cancer represents 14% of all cancer cases and 27% of cancer deaths. About 90% of people who have lung cancer will eventually die from the disease because it's not found until the cancer is in an advanced stage. These statistics are alarming, and investment in research has produced a possible suggested screening for those at risk for lung cancer. Today, I'm joined by Drs. Ung and Johnson from West Kentucky Heart and Chest Surgery at Baptist Health Paducah. They are here to discuss lung cancer and a new screening offered at Baptist Health Paducah to detect lung cancer. The lung CT scan is new to our area, and great things have come from this screening to patients in our community. Welcome to the show, and thank you for joining us today.
Thank you for having us.
First of all, if we could just start out learning a little bit about each of you. So Dr. Ung, would you like to start?
My wife and I have been in Paducah for the past 6.5 going on to 7 years. We have 4 daughters here that love our community and such, and basically we chose Paducah just because of the smaller community, and we've always been in the Midwest region, and so far it worked out very well for us.
Well, good. We're happy to have you in our area. We've heard great things about you.
Thank you.
All right, Dr. Johnson.
Yeah, I've been here for about 25 years with my family. My children grew up here. They've graduated from school and are out on their own now. I was brought here by Dr. Robin Howe, who's now retired, and so I've been here the longest, and have Ken's been here about 6 or 7 years, and we have another partner, Dr. Nicholas Lopez, been here about 3 years.
All right, so you're the veteran.
Yeah, I'm the old man, as I like to say.
But obviously you're in love with Paducah and you're staying,
Yes.
right? Yes. Well, as surgeons, I'm sure you've seen many adverse effects smoking can have on a person's lungs, and it's been shown that about 85% of lung cancers are actually caused by smoking. So what do you suggest to anyone that maybe currently smokes or has concerns about lung cancer?
I think that, you know, the reason we're here today is to talk about that low-dose CT screening for select patients who are at high risk for developing lung cancer. And we'll go through the criteria for that at the end of this program. But I think that would be the very first step in taking that if they are concerned about lung cancer for themselves. And go ahead.
It's just one of my concerns is that a lot of older people have smoked for a long time, didn't know the problems with lung cancer and the problems associated with smoking, and they got hooked on it when they were young.
Right.
Most people that have had lung cancer started smoking before the age of 18. What concerns me now is to see the young people smoking, and I understand that at that age you want to rebel and those kind of things, but some of the latest studies show that 25% of high school students and something like 17 or 18% of middle school students use tobacco products. And if we could get the information out there now before they hook themselves and before they have 20-pack years on their history, and that's a difficult thing to do, but that would really help.
Right. You're definitely right. I've served on several coalitions and across the purchase area, and they do KIP data every year in schools where they, you know, question children on behaviors, and smoking is one of those. And we do see a big increase from between 6th grade and 10th grade. You know, those middle school years is where those behaviors start to change.
It seems to be in the South, maybe the West too. I mean, the smokeless tobacco, which is a horrendous problem too, is big.
Right, definitely. Well, what do you suggest to a patient maybe that even wants to quit smoking? You know, some people may just be concerned that they may have lung cancer or may develop it, but others out there may actually want to stop smoking. So what suggestions and what help do you offer to patients as they come into your office? Dr. Johnson, you've been doing this for several years. I'm sure it's probably changed over the years.
And, you know, it's interesting. We're here to talk somewhat about the lung screening program, but part of our the educational process of this was to try to get people to stop smoking. That'll probably do more good for these people than the screening itself. people think of lung cancer, they don't think about emphysema and all the mouth and throat cancers, all the other problems.
Right,
with it.
COPD.
Yes.
And
And, you know,
coronary disease too. Yes.
the problem with smoking, you know, it's one thing to die of lung cancer, it's another thing to sit on your couch for 10 years with a oxygen mask and being able to do that. So when we talk to people, especially with the lung cancer screening program, they at least have shown an interest. So we feel like the time is right now to go ahead and try to help them. And we have lots of programs, the Cooper-Clayton Smoking Cessation Program. We talk to people about nicotine patches, Wellbutrin, Chantix, lots of different ways. One thing I can say over the years is that I found that there's no one right thing for everybody. And some people can cold turkey it. That's really hard for a lot of people. Other people swear by one way and say the other thing was like water.
Yeah.
So it's really difficult to tell, but we do have a set of, in this day and age, a set of different things and a big armamentarium to try to help them stop smoking. But it's a hard thing to do.
I think that there's, you know, nowadays there's, you know, more and more people are hooked up with a primary care provider, whether physician or nurse practitioner or whatnot. And I think that, you know, going to them, you know, having access to the Wellbutrin and the Chantix and such, and basically there are side effects to these medications. And having an established relationship with a healthcare provider is important. And I think that's one of the things that we stress about, even in this lung cancer screening, is that, you know, the involvement of that primary care provider is very key in maintaining that overall healthy balance.
Absolutely. I think it's definitely a relationship that needs to be there with the medical provider because, too, depending on some of these different medical conditions that they may have, their dosage level may need to be different. So definitely have that conversation with the physician about what they should do. We have seen a decrease in lung cancer incidence and deaths for men for some time now. We've just started recently seeing that with women, though. We kind of find that interesting to see that. But what have you seen locally here?
Well, our sample size is somewhat small, so I'd say just in gestalting it, I haven't seen much difference.
Okay.
From my career now, which is over 30 years of doing this, it was initially a man's disease, and then the Virginia Slims came out, and then it became a women's disease, and now it's both others' disease.
Yeah, and as you know, the lag time between smoking and then development of cancer and such is, you know, over a decade, 15 years or so, and so that may be why we're seeing, you know, a slight decrease in men as we, you know, men are starting to come off of the cigarette smoking and such, and then women may, you know, they may be taking that step also, but it's just lagging in behind in terms of the incidence of cancers and such.
Great point. Okay. Well, someone may be out there today and they may think, you know, I have some symptoms that have been lingering and they're not really for sure what the symptoms may be. So let's talk about some of the symptoms one might have if they have lung cancer, because obviously they could have some, they may not have any, you never know, but what are some of them that they may have?
Well, the chief ones have to do with the metabolic effect that the cancer has on the patient. And by that is particularly worrisome is coughing up blood.
Right.
That's not normal in any situation. Now there are some situations people think, well, it's my sinuses or I've been coughing, but that's a particularly severe one. Persistent cough, there's lots of reason for that, and smokers all say that I have a smoker's hack. So that's a little less specific, but if it's a change in your cough, that's the difference. Also, weight loss is a bad sign. Voice changes, and people wonder why their voice changed. Well, part of it is the inflammation on the vocal cords, but the real thing is we worry about a cancer hitting one of the recurrent laryngeal nerves, which controls your voice box. So those are the major ones, I think.
It is, I agree, and what Dr. Johnson has brought forth are the symptoms of lung cancer or that have, they're pretty much advanced cases of lung cancer. These little tiny nodules and such that we're hoping to catch, you know, in terms of the ability to potentially cure patients of cancer, are much more subtle. Basically, they don't present with any symptoms at all. But yes, certainly, you know, the thing that I caution patients with is that any change in their health, whether it's a new cough or new weight loss or whatnot, or the other things that Dr. Johnson has mentioned, do seek some medical help with that. And the primary care provider is a key person. If they wish to have a more specialized care, there certainly are pulmonologists in our area that are more than happy to help take care of our patients.
I've noticed in my career is that you should pay attention to people that say something is just not right. And like in breast cancer, they say the women are the best at doing their own breast exams because they know their own breasts. And you know your own body, and if you have a smoker's cough, but now that it's different, or if something is just not right, that's the time to seek help, because hopefully you can get it before something really adverse comes along.
Absolutely. I always get questions. A lot of people ask me, well, how long should I let these symptoms go on before I talk to a physician? I always tell them, if it's 2 weeks, you need to go. That's not normal to keep doing something.
I mean,
for more than that.
just set a time frame. Whether it's lung cancer, whether it's heart disease or whatnot and such. Just set a finite time where if it's not resolved by whether it's 1 week, 2 weeks, or 3 weeks or so, make a point to follow up with a primary care provider. It certainly is.
Yeah, and then I encourage them to if they run tests and they don't find anything, just keep going at it, keep going at it, running tests until he finds what is causing it. Because obviously, just like you said, you know your body, you know that something's not right, so something's causing it.
Right.
There's a lot of fear, and people worry that they're going to find out something they don't want to know. And that's the real tragedies are people that have known for a while, but they just hold off, and then it's too late. So I would like to let people know that there are a lot of treatments and there are a lot of ways that we can make things better, but the sooner the better.
Yeah, just the simple fact of not wanting to know the truth oftentimes ends up hurting patients much worse off in the long run. And there are, whatever it is that is wrong, whether we can take care of it here in Western Kentucky or not, we have resources in tertiary academic centers and such we can certainly refer them to.
Absolutely.
And so it's not, basically, they shouldn't just ignore it or just think that it's going to go away on their own, basically.
Well, we know that cigarette smoking plays obviously the biggest risk factor for lung cancer, but there are other risk factors for lung cancer. So let's talk just a little bit about those as well.
Well, it's very interesting. When I first started my residency in surgery, and I remember one of the experts, I did my training at Vanderbilt, and he said, if someone tells you, with lung cancer, tells you that they've not used tobacco, they're lying to you.
Yeah.
And the latest figures that I've seen is now that 10% of the people that have lung cancer have really never smoked. That doesn't mean they haven't been exposed to secondhand smoke.
True.
The technological society, there's a lot more exposure to radiation. There's a lot more exposure to some toxins, such as the radon gas that people what they call it, the silent killer, and you have to buy those little radon things. It's actually a pretty good idea to do that. And if you're in around any kind of chemicals that are involved in your work and you're inhaling them, then you're at a higher risk, no matter what the chemical.
Right.
It's chemicals, metals, whatnot. Any chronic irritant basically has that potential. We can talk about asbestos, but typically that's associated with mesothelioma rather than a true lung cancer per se.
And I think we've become much more educated now about asbestos over the years, but definitely too, whenever you said that about your residency with, secondhand smoke, we didn't know about that, but I'm sure as, today, any student going through medical school, that's one of the first things, that they definitely are
We
told
also
about.
try to say, think about your children.
Yes.
Yeah. And then what about any genetic linkage to lung cancer for families?
Well, the genetic linkage there probably is, but we don't know a lot about it yet.
Right.
When you look at epidemiological studies, there are some cancer-related correlations between some families. Some of the early research is has identified a couple on chromosome 6 and 12. It doesn't really mean a lot, but it means there probably is, but there's not enough to make some recommendation on a person that, say, mother had lung cancer, I'm genetically going to have that more
Right.
chance. Probably not enough to know that for sure, but it's certainly enough to say, well, if she got cancer, I probably shouldn't be smoking. I
Yeah.
shouldn't be having a high-risk job.
Yeah. Yes, definitely. Well, I think, there's no telling what the future will hold with that. Definitely a lot of research going into that, so maybe in a few years we may know.
Oh, I think they will. I mean, the focus in medicine now is genetics and,
yeah.
and genetic expression, and it's going to make things a lot better. And I think one of my future hopes is there's going to be a blood test for lung cancer.
Right.
And they have some now, but they're not perfect and they're very expensive. But that's coming, and that'll be a big break, I think.
Definitely. And hopefully we'll be here to see that too.
Yes, hopefully.
Of course, we'll be out of a job.
That's all right.
Well, I'm sure you'll still have some.
We'll find something else. Yeah.
I'm sure you'll still have some. What about a medical history of tuberculosis? That's been talked about some.
Well, so tuberculosis is an infection, and oftentimes, they're often more prevalent in third world countries, and sad to say, smoking is often more prevalent in third world countries and such also. So it is difficult to find a particular linkage other than chronic inflammation that could potentially cause potential progression to potential cancer. But
Okay.
I don't think that there's any hard linkage to say that tuberculosis is associated with cancer per se.
Okay.
One of the problems is tuberculosis in a lot of people is chronic. And you're coughing, and you're sometimes coughing up blood. And so you have the same symptoms that you would have with lung cancer. However, in at least, we don't see in my career here in the United States, I haven't seen many incidents of tuberculosis. However, I would say that if you've had tuberculosis in the past and you start coughing up blood, so you still need to be checked out the same way. Because just because you had it in the past doesn't mean you're immune from having lung cancer.
Right. There's only a handful of preventive screenings that exist, and so lung cancer is one that hasn't had a preventive screening recommendation. However, recently a new screening was introduced for lung cancer, and guidelines have been established somewhat for that, and have laid guidelines out for those that would benefit from the screening. Baptist Health Paducah is kind of on the forefront with this screening, and they recently started this screening, which is the low-dose lung CT scan. Both of you have used this screening. And so can you explain just a little bit about the procedure? We say low dose. Viewers may
Right.
not understand exactly what that means.
So it's just to make it more in terms of more common knowledge here. There's background radiation exposure for basically anywhere we live. If you're up in up in Denver and such, you may be more exposed to background radiation than say here in Paducah. But still, there's still some background radiation leakage. And a regular chest X-ray, for example, just one regular chest X-ray is equivalent to about 10 days worth of background radiation exposure. A CT scan, a regular CT scan of the chest, is about 2 years worth of background radiation exposure. Now, a low-dose CT scan of the chest is about 60 days worth of background radiation. So, it's almost a quarter of the exposure. So that is basically the background in terms of this low-dose screening trial.
I was just going to say, for the longest time, people knew that lung cancer was a terrible thing, and that if we could find it sooner, we could do better.
Definitely.
When chest X-rays first came around, and they knew people that smoking was a high-risk behavior, they said, let's try and get a chest X-ray on everybody that smokes. It really didn't work out because chest X-rays are not good at finding small nodules, and the fact that you have a fair amount of radiation exposure. So in any screening test, you weighed the pros and the cons, and it didn't work out. Fast forward a few years later, CT scans come out. They're much better at seeing the tumor, but then they give you a whole lot of radiation. So the statistics really didn't work out for it to be a screening procedure then, because we were probably given more with the CT scan exposure than they were from the smoking. Fast forward to several more years, now we have the low-dose CT screen.
Right.
In the last 2 or 3 years, several studies have shown that to be helpful, that the risk of a low-dose CT scan is much less than the possibility of finding it. And it hasn't been worked out 100%. That's why a lot of the insurance companies, Medicare, won't allow CT screens. But I'm fairly confident seeing the results of our tests that in the near future they'll pay for, it'll pay off because it's better for the patient's health.
Right. The U.S. Preventive Task Force, of course, releases guidelines, and for a lot of these insurance companies to go by. They're the ones right now that are currently looking at that and set out some recommendations. And Baptist Health is actually following those guidelines right now for eligibility for the screening.
Yeah.
So let's go through those then, because there's somebody out there that may want to know, you know, how do I
Right.
get this screening? Am I eligible? So what is the ideal candidate for the lung CT scan?
So basically, the low-dose CT scans came about from the National Lung Screening Trial that was first started up in 2002 and closed in 2007. And I think they finally wrapped everything, all the patients were followed up and such in 2010, and actually published in 2011, 2012. And on that original study, they found that in high-risk patients, deemed as patients who were between the ages of 55 and 74, patients who were who have smoked more than 30 pack years, and who have quit smoking less than 10 years ago, were those particular groups of patients or people who would benefit from this low-dose CT screening. And that reduction in risk was basically a 20% reduction in death and mortality.
And then for Baptist, your guidelines state current heavy smokers or have quit within the last 15 years?
Basically, what happened was that the United States Preventative Services Task Force reviewed the research that was done by the National Lung Screening Trial, and basically saw that that basically they can extend the criteria a little bit more. Instead of just the age of patients being 55 to 74, they can actually extend it up to 80 years of age. And then quitting smoking, they can actually quit within 15 years rather than just 10 years. Again, alluding to the fact that the effects of tobacco, of smoking and such, takes about a decade and a half to really wear off.
Okay, perfect.
What a lot of people that come to us don't understand, they don't understand screening versus workup.
Right.
And it's very important to know that if you have a symptom, if you are coughing up blood, if you're losing weight, if there's a suspicion of you having lung cancer, this is not for you. You go ahead with a regular CT scan. You'll probably have to have bronchoscopy and workup for that. This is for people that are absolutely asymptomatic, which is why they have to go through this criteria. So they're at a higher risk, but they're not having symptoms.
Okay, that's good to note. Now, some people out there may want to know, does this cost money? Is Baptist doing this for free, or is my insurance going to be billed? Or
well, as Dr. Johnson alluded to earlier, insurance is not paying for it at the moment, just because it is a screen and it's not something that's paid for by Medicare and such either. The cost of it is $200, which is well below the cost of a regular CT scan. Basically, what that cost entails is some minimal fee for the hospital and the radiologist who reads the films. We basically have volunteered. Just basically, the reason why we wanted this program to start was because we, all three of us were basically tired of seeing patients who were young, whether they're young or old, but basically patients who come to us with very advanced disease. We talked about the coughing up blood, the weight loss, and such. Those patients, basically, we said, have exhibit symptoms of advanced lung cancer, and really surgery is only good for, in terms of curative purposes, only good for those very early on lung cancers. And so, as we alluded to before earlier, chest X-rays, blood work, and such have really not proven to be a very useful screening tool. And therefore, this is the first study. Basically, it's a very large study and over an extended period of time, and well thought out in terms of the ability to minimize the death from lung cancer. And so, Yes, so it's $200 paid for out of pocket for the patient. And it includes that same day, you know, the CT, they come in that day for the CT scan, and they get to talk to one of us, Dr. Lopez, Johnson, or myself, regarding the results.
That same day.
That
That's
same
great.
day.
Yeah.
And we also, we try to keep in touch with the patient's primary care provider if they have one. And if not, we try to set them up with one if they so desire. We talk about the Cooper-Clayton method for smoking cessation, in addition to the medication, nicotine patches and whatnot.
Perfect. Well, if somebody's out there maybe that thinks that this might be something for them, how can they call to schedule an appointment?
The Baptist Health Line is what we are using right now, and that phone number, I don't know if you have it on there.
Yeah, it's on the screen
okay,
right there
yes,
for them.
575-2918. They basically call that number, and one of our nurses will pick that up. And basically they have a criteria of questions that that patients must meet or people must meet in order to go through this screening. Again, we are looking for high-risk patients, and therefore the age has the age has to be in the appropriate range, the 55 to 80 years of age. The years of smoking, they'll ask how many packs a day have you been smoking, multiplied by the years of smoking that they've been smoking gives us packs per year, and then whether or not they have symptoms, again, trying to delineate the screening from the actual symptoms of lung cancer. They cannot have weight loss, coughing up blood, and those type of things.
Right.
And lastly is trying to make sure that they've quit within the last 15 years. Again, because if you've quit 20, 30 years or so, it pretty much likelihood of you developing cancer is pretty much lung cancer is pretty much back to the general population's baseline.
One thing I'd like to say also is according to the money factor, if you call in thinking that you want this $200 CT scan and you feel that you want to pay that money to know that, but you're having symptoms and you need to have a regular CT scan, it's a lot more than $200.
Right.
However, if you're having the symptoms, then your insurance will pay it.
Okay, perfect.
Yes.
We'd like to add too that Baptist Health Paducah's Center for Cancer Cares recently received their 5th consecutive 3-year national accreditation with commendation from the American College of Surgeons Commission on Cancer. So viewers can know that they're getting excellent care here in our area, and you guys are certainly part of that as well with surgery and then perhaps chemo or radiation that lung cancer patients might need. I want to thank you guys for coming today and taking time out of your day to join us and truly being able to share this with the community, because it's definitely something that everyone in the community needs to know about and be able to take advantage of. And if you might qualify and need to be screened, you can contact Baptist Health Paducah today. And again, that number is 575-2918. The line is open 24 hours a day, 7 days a week. Make the call. That could save your life. If you have questions about today's show, or if you'd like some more information about what the doctor shared today, please call us at the Kentucky Cancer Program at 442-1310. Thanks for watching today and have a great day.